Hello, my name is Lianne Wood. I'm a physiotherapist and I work at the University of Exeter as a health researcher. I'm also a specialist spinal physiotherapist and I currently work at the Royal Devon University Hospitals Healthcare NHS Trust. I've worked as a spinal practitioner in secondary care or specialist centres for many years now, but now work more in an interface role in the community. My research focuses on people with musculoskeletal pain across predominantly spinal conditions, but neuropathy conditions as well. And my goal is to try and improve their journey to diagnosis and improve the treatments that we offer them to try and help make these better and more effective. I became a clinical academic probably about 15 years ago when I started my master's or finished my master's in 2011. I really loved the duality of having research alongside my clinical practice when I was seeing patients on a day-to-day basis, and really felt like that made my clinical practice more relevant and more evidence-based, and felt like my research was more based on clinical need and gaps. As I've evolved as a researcher and a clinician, I continue to believe it is such an important role, and having that duality really helps me to be more critical of what I read as a researcher and as a clinician. So before I use evidence in with patients that are sitting in front of me, I'm very critical of the source and the evidence and the quality of the evidence that I'm reading and how this may apply to the patients in front of me. And equally, as a researcher, knowing what my patients are telling me from their difficulties in access or failed treatments or things we don't really have understanding for why mechanisms, why certain treatments may work in the ways that they appear to or how we initially thought, helps us to generate new research ideas or identify gaps where we need more evidence. So I really believe being a clinical academic is such a meaningful and worthwhile profession, and the job satisfaction I get from being a clinical academic is huge. I have persisted in maintaining my clinical hours despite there not being a clear pathway for me down here in Devon. I moved from Nottingham, where I had the trust and expertise of many years of working with a team who was happy to support me, to give me some research time and to let me work on research projects relevant to our team. But having moved localities, I realized that so much of that clinical academic role is built on trust and relationships. And when you move somewhere new where you don't have those existing relationships or reputation, it's that much harder to make a new position. And yes, we do have follow-up principles, and there is much more support out there from a governance point of view to support us as clinical AHP academics to fight for those roles. But there becomes a limit as to how much each individual can fight. And certainly as a researcher and academic, it feels hard enough trying to fight for grants and publications. And fighting for new roles is tricky. And so I really believe in the value of this project, trying to see if we can support our clinical academics, particularly postdoc. I think there's a real need to support people who've gone and specialized within a topic area, within a clinical area, to bring that research and specialist knowledge back to our clinical settings and use them to build momentum and generate more teams and research activity. And I feel there's a real gap within our clinical teams for this, and that it's just not recognized or valued. And so, yeah, I suppose my reflections are that as clinicians, there's a fair bit of support to get people into the first early stages of research, particularly pre-doctorally. There's a lot of chief nurse fellowships or chief AHP fellowships to get people to dip in and do some service evaluation projects. There's a little bit less support for PhD projects and in terms of the duration of the funding and the time away from clinical practice. But certainly from a postdoctoral perspective, there's much less support and much more understanding as to how, as clinicians, we can navigate this in a cohesive way that is not disruptive to families, mortgages, or career opportunities. So I really believe in the importance of this project and in the importance of being clinical academics as AHPs. And certainly my desire is to try and help grow clinical academics across all allied health professionals and support the momentum of keeping our researchers within clinical practice and not just into academia alone. Anyway, I'm happy to talk about this in more detail with anyone who wanted to. So do contact me if I can be of help. Thank you.